Hi, I'm Dr. Jessica Schmid, DO. I'm a family practice physician at Southwest Health Platteville Clinic, and I also do obstetrical care. My personal philosophy of care for patients is to kind of look at them as a whole person, not just what they're sick with or what their main complaint is, but to kind of try to find the back aspects of where we can improve things to try and prevent them from getting sick, so more of a preventative approach, obviously treating them while they are not feeling well as well, but keeping them healthy as a whole person, mind, body, and spirit, as well as trying to make it as cost-effective as possible for patients. I went to UW-Madison and got a double major in sociology and biology. Directly after college, I went to Kirksville College of Osteopathic Medicine in Kirksville. The first 2 years of med school are spent doing book learning, and then the second 2 years are done doing clinical learning, and my clinical education was done in St. Louis, Missouri. Following that, I got placed in residency in St. Luke's in Milwaukee, which is where I completed my family practice residency, and then I moved here to Platteville and started working here shortly after. I think the most rewarding part of medicine for myself is, or what I'm passionate about, is developing really good relationships with my patients as well as their families, to try and provide them with a meaningful experience whenever they come to the doctor or the hospital, as well as providing them with the best possible care, because nobody knows their health as well as themselves or their close loved ones. I love providing care for pregnant patients. It's one of my favorite parts of medicine, as well as I do some osteopathic manipulation, which is a little bit of adjustments when people request it. And I also do some integrative medicine, so working on other things that might treat ailments or issues that aren't necessarily Western pharmaceutical medications. I chose osteopathic medicine when I was looking for medical schools. I applied only to osteopathic programs because their philosophy of medicine fit more in congruence with my own, and the thought that the person is a whole person and we should work to keep them healthy and not just treat them when they're sick. What drew me to Southwest Health was not only the location. I'm from Southwest Wisconsin. I love it here. I've lived here almost my whole life, so coming back was something I very much look forward to, just for the geographical reasons as well as the communities in the area. But Southwest Health in its own is kind of a special entity. It's one of the few places where it's a small community practicing together as opposed to a larger corporation sort of setting. And I think the Southwest Health is a unique business kind of model as well, because it focuses really on taking really good patient care and providing really good care for the community, which you don't always get in some of the bigger health systems. Coming home to provide care meant being close to family as well as being close to communities I already knew and loved, and that I knew that I would get along well with the patients and be able to develop really good relationships with them. In my spare time, I like to do a lot of reading, mostly medical journals, but occasionally a Harry Potter book or some other, junk reading that's fun. I enjoy cooking and baking. I also really like being outdoors when it's possible, so my favorite kind of winter activity is cross-country skiing. Favorite summer activity is canoeing. I'm married. I have a small dog named Princess Leia. I'm a little bit of a Star Wars fanatic. And I have lots of extended friends and family in the area that I'm getting to spend a lot more time with, which I really appreciate.